Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, psychiatrist and addiction medicine specialist. Today's Kevin MD article is Why Kratom Addiction is the Next Public Health Crisis. Muhammad, welcome back to the show.
Thank you very much for having me to talk about this timely topic on kratom that's been heavily used by the US population and that's been posing a significant problem for the addiction community and for as a public health, as an upcoming public health problem.
All right. So, before talking about your article, just to get everyone on the same page, just tell us what kratom is.
All right. So kratom is the name of a substance. It's actually a plant that actually grows in Southeast Asia. The name of the plant is Mitragina speciosa. It's actually a large leafy plant that's tall. It's about 15 to 20 meters. The leaves actually look like mint leaves. They're a little bit larger, but they look like mint leaves. And it belongs to the same family, a distant cousin of the coffee family. It grows in Cambodia, in Thailand, in Malaysia, in Indonesia, in Myanmar, which is Burma, and Papua New Guinea. So it is pronounced kratom, Kratom. The American population may pronounce it as kratom with like a D. In fact, in Southeast Asia, some of the countries that are French colonies pronounce it in a different way. They pronounce it kratom. So totally different pronunciation, it's the same substance. So basically, over the last 10, 15 years, this have been recognized as an herbal substance that people used it. They started using it in Southeast Asia probably in the late 90s and kind of took off in terms of its popularity. It could be used as leaves, so that people could use it as teas. They boil
Hmm.
it. They can make it powder that it could be taken also. It could be smoked. And most recently, over the last 5, 10 years now, they're turning the powder into tablets that are being consumed and that are being available in different shops in the United States. So it's a significant plant. There is reports that the United States actually imports about 2 to 3 metric tons of kratom per month. So the usage is significant, and there are estimates that about 2 to 3% of the U.S. population is using kratom on a regular basis. So we are seeing this as a significant public health issue.
Now, the people who use kratom, what are the alleged benefits or medicinal qualities that people are going for?
Sure, sure. So when people started using kratom in Southeast Asia, actually, starting like 100, 150 years ago when the plant was discovered, along with the discovery of tea, coffee, it was discovered as a plant that could be used as a tea that actually at smaller doses had stimulant effects. And we know biochemically that actually it hits some receptors that give it stimulant property. And at higher dose, actually, it hits the opioid receptor, the mu-opioid receptor. So it had actually a pain relief quality. So actually, workers in Southeast Asia utilize the kratom, the Mitragina speciosa plant leaves
Hmm.
as something that they used in long days of labor. It gave them a little bit of energy. And then toward the end of the day, when their brew actually matured, it was a larger dose. It kind of gave them that pain relief property after a long day of work. But they were using small amounts at that time, and people did not become dependent on it. Now, what happens is that these leaves, they are actually purified, they're intensified, larger doses, and they're actually causing immediately to hit the opioid mu receptors that gives them an opioid like property effect on people, and that's how people are becoming dependent on them.
And tell us about some of the side effects of people taking kratom. Would it be similar to opioid-like toxicity?
Yes. So what we're seeing is that there's a big chunk of the population that pursue kratom. They actually purchase it in different areas. It could be as a powder or pills, or they could smoke it. And they're utilizing it on a daily basis, and they're becoming dependent on it, actually. And they're actually experiencing significant issues with withdrawal. There's two levels. There's the toxicity. So a lot of people are seeing when they overuse it, they see significant amount of toxicity. We've seen the Poison Control Center in the United States have seen significant numbers of toxicity and even death. There's between 2 to 3,000 reported deaths that happened from kratom toxicity. And the toxicity could be like an opioid overdose. And actually, sometimes when people overuse kratom, they will require resuscitation and they will require naloxone to be actually revived to dissociate the kratom from hitting the opioid receptor if it's used excessively. So it's the same symptoms of using kratom that you see with opioids, though it's a little bit weaker. It's definitely a little bit weaker than fentanyl, but it's the same level as using opioids and using heroin that's found in the street. So that's a significant issue. And people become dependent on it. So they use it on a regular basis. And then when they stop it, that's when they experience significant symptoms that are very, very similar to opioid withdrawal symptoms and end up being admitted to inpatient drug and alcohol rehabilitation, where we actually have to tend to them in a similar way that we tend to individuals who are addicted to opiates.
And where can one find kratom? I see it in the grocery store, right? They have these kratom seltzers and kratom drinks. Sometimes I see kratom bars. So, how easily accessible is kratom?
So it is available. In fact, kratom and its products are actually illegal in 7 states. The last state that completely banned it was actually Florida last month. The Attorney General and the Surgeon General in Florida moved it to a Schedule 1 substance. So actually, kratom is not available in Florida. It's illegal for in Florida, so it was completely banned. There are other states where kratom is not available, but it's only about 6 or 7 states in the United States. So it is available in smoke stores. It is available in supermarkets with multiple actually formulations. So tablets, and you see those little bottles, the 5 hour energy.
Hmm.
They produce similar ones to those with kratom. And sometimes kids may purchase them, younger adults may purchase them without notice the fact that they're using kratom. They become dependent on them because they hit the opioid receptors. Last month, actually, the Food and Drug Administration actually called on the Drug Enforcement Agency to actually ban kratom and list it as a Schedule 1 substance. So kratom, the plant, has two distinct neurochemicals. It is an alkaloid. It has about 50 different compounds, but the two major ones that you hear about that is metregynin and 7-hydroxymetregynin, so 7-OH they call it. And that 7-hydroxymetregynin is the substance that is actually very, very potent that hits the mu-opioid receptor. And it's actually about 40 times stronger than hydrocodone or morphine. Metregynin is not as strong as hydrocodone or morphine. So the 7-hydroxymetregynin is the substance that the FDA and the DEA are targeting. Unfortunately, what's happening is that the manufacturers have departed away from just the kratom leaves, the natural product. They actually resort now to chemically manufacturing 7-OH in those tablets that you see or in those small bottles and significantly increasing the potency of those compounds to actually hit the opioid receptors in a significant strength. And so they're getting close to heroin, they're getting close to the strength of fentanyl, those products that are available. Unfortunately, also, there is a big movement in the United States of natural kratom users that swear by its properties with helping them with energy, with helping them with fatigue, with helping them with pain. And unfortunately, that movement may be swept away with what we're seeing from the DEA and the FDA because of their inability to specifically say, well, we're going to ban only 7-OH. Well, but 7-OH is part of the kratom plant. So once you ban that, you effectively have banned the natural kratom plant. And it's very, very hard. A lot of these agencies don't have those surgical scalpels to just say, we're banning this substance, but
Hmm.
not this substance. So we're probably heading toward kind of kratom being banned completely in the United States. Hopefully it's going to happen soon enough without this becoming a significant public health issue.
Now, in some states, you said put kratom as a Schedule One drug. Can you remind us what that means again?
That means again that it's an illegal substance. So a Schedule One is a illegal substance that has no pharmaceutical benefit whatsoever, and it's illegal substance. So, like for example, heroin is an illegal substance. It's a Schedule One. LSD is an illegal substance. So that's just kind of example. So those substances are illegal in the United States, and some of these states are moving the kratom to that category, though it has not been done federally. So kratom is still available in a lot of states, at least 43 states that I know of, where kratom is available in shops. You can see it in grocery stores and different compounds, different doses, different formulations. And that's the danger is people don't know what they're using, how much they're using until they get in trouble or they feel withdrawal symptoms when they stop using what they're using.
Now, for those kratom users who are listening to you now, maybe they get an occasional kratom drink from the supermarket. How much kratom is actually in that drink? And is there a real risk of addiction by a supermarket kratom drink?
We don't know. The answer is we do not know what's the dosage. I mean, they may list the dosage of kratom that is in the drink. However, we do not know because of the variety of these formulations. We don't know what's the actual dose of metreginine or 7-hydroxymetreginine in the drink. And people who use it on a regular basis, they may be consuming a significant amount of a substance that hits the opioid receptors and actually may create a dependence. Or individuals who are susceptible to addictive disorders may use it one time, two times, three times, and they actually may like the effect of the opioid receptors being stimulated. It's a partial agonist for the opioid receptors, treginine and 7-hydroxymetreginine. And people just become dependent on it. And they say, well, it's just a drink. It's just an energy drink that I'm using on a regular basis. And then people just feel the urge to continue to use this because they become physically dependent on it. And the next thing you know, they start having side effects and withdrawal symptoms, and they need to be tended to medically to actually be treated from these withdrawal symptoms from kratom. So, unfortunately, what's happening is we don't know. We don't have a lot of answers to that. And we really need to be able to basically tell the public
Hmm.
that now, the way it is, because we don't know what's going on, any use may be dangerous at this time.
You mentioned that seven states have put kratom on Schedule One, and you did allude that kratom may be banned in the near future. Do you see any middle ground where it's just more heavily regulated?
It could be more heavily regulated. I think to their credit, the FDA actually brought in some advocates that basically talked about the beneficial effects of
Mm.
botanical kratom and its benefits that it can cause with helping pain. But we are also seeing a lot of individuals who are basically dependent on opiates resorting to using kratom to actually manage their withdrawal from opiates. So we're seeing that also. And that is also a dangerous trend that we're seeing. So we're just kind of seeing multiple dangerous trends that are happening simultaneously. And definitely there's going to need to be an intervention. What is the intervention? Whatever they're going to ban, it's going to sweep the botanical use of kratom with it just because botanical kratom have the 7-OH, which is the substance that was declared as a public health emergency and that people use on a regular basis in the tablets and those drinks. And I don't see where there's going to be a middle ground where they're going to be able to exclude one substance but not the other.
We're talking to Muhamad Aly Rifai, psychiatrist and addiction medicine specialist. Today's Kevin MD article is Why Kratom Addiction is the Next Public Health Crisis. Muhammad, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Kratom is a botanical substance that has some beneficial effect. Unfortunately, over the last few years, we have seen an exploding phenomena of individuals, young individuals, Americans who are using kratom in an unintended ways where it is used in tablets, capsules, teas, drinks that creates a significant health hazards because it creates a phenomena of dependence on kratom that affects opioid receptors. Basically, the regulatory agencies, the Food and Drug Administration, the Center for Disease Control, and the Drug Enforcement agencies have rallied last month to make decisions on what are they going to do in terms of kratom. Unfortunately, because of the significant chemical entities that are involved with kratom, they may not be a middle ground. And we've seen that 7 states have declared kratom and 7-hydroxymetragynine as Schedule 1 substances. And I hope that there may be a middle ground for the botanical users of kratom in a beneficial way that would not impact them. But I think that we're going toward a banning of kratom, and it's going to be declared a Schedule 1 substance.
Muhammad, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
My pleasure.